and this is my checkoff. The 8 pre-procedural steps are: first, you're going to check all orders and nursing plans. Then you're going to gather all supplies and equipment. Then you're going to wash your hands and maintain standard precautions. Then you're going to introduce yourself to the patient, check 2 patient identifiers like their name and date of birth. Then you're going to provide privacy by closing all curtains and shutting all doors. Next, you're going to explain the procedure. Then you're going to raise the bed to an appropriate height. So first, we're going to start with the skin assessment. So upon inspection, we can see that the color of the skin is appropriate for race and ethnicity. Upon inspection, we can see that the skin is moisturized, the temperature of the skin is warm, and the texture of the skin is smooth. There is no dryness or perspiration. The turgor of the skin returns to baseline in 1 to 2 seconds, so there is no tenting. If we press down on the skin, there is no edema or indentation. Inspecting all the skin that is exposed, we can see that there are no rashes, no ulcers, no lesions, and no lacerations. Next, we'll be moving on to the hair. So upon inspection, we can see that the hair is evenly distributed. The hair is moderately thick. Upon palpation, we can see that the hair is lubricated. There's no brittleness or shedding. There's no excessiveness of oiliness or dryness. We can also see, upon palpation, that the scalp is intact. There are no vermin. There is no lesions, no lacerations, no nodules, no rashes, and no scales. So next, we'll be going to do the nails. So upon inspection, we can see that the shape of the nail is concave, the color of the nail is translucent, and the color of the nail bed is pink. The capillary refill is less than 3 seconds. There is no cyanosis, there's no brittleness, and there's no splitting of the nail. Upon palpation, we can see that the nail is appropriately thick, so there's no excessive thinning. So, Mr. Iso, can you please put your fingers like this, with your nails touching each other? So we can see that there is a small little diamond shape in there, and this shows that there is no clubbing, so the curvature of the nail is intact. Next, we'll be assessing the head. Upon inspection of the head size is normocephalic, the head shape is round. Upon palpation, there are no masses, no nodules, and no indentations. Upon palpation of the frontal sinus and the maxillary sinus, it is non-tender. Now we will be moving on to the eyes. Upon inspection, the position and alignment of the eyebrows, the eyelids, and the sockets are symmetric. Upon palpation of the lacrimal bone, there is no drainage and it is non-tender. The sclera is white. Mr. Iso, can you please pull down your lower lids? And the conjunctiva is pink and moist. Now we will be assessing visual acuity. So Mr. Iso, could you please sit in your chair and focus on an object over there? Make sure your head is staying still. So from this test, we can see that the pupils are equal, round, reactive to light, and accommodate concentrally. The red reflex is centralized and it's intact. Next, we'll be doing the cardinal gazes. So Mr. Iso, could you please sit still? And you're going to follow my finger. Make sure you follow my finger with just your eyes and make sure your head is still. All right? So we're going to go up, in, down, in, up, out, and down, out. So from this test, we can say that Mr. Iso has no nystagmus. So now we'll be going on to the ears. So upon inspection of the ears, they are symmetrical and proportionate. There is no erythema to be seen. So when you're looking at the ears, you want to make sure for a child you use the otoscope pulling down the pinna, and then for an adult you want to make sure you pull up the pinna. So upon palpation, the auricle is non-tender. So for now, for an adult, we are going to pull up the pinna and look inside. So we can see that there is no excessive cerumen, there's no drainage. The TM is intact. The TM is a pearly gray and white color. The bony structures are also intact. On the right ear, the cone of light is at the 5 o'clock position, And on the left ear, the cone of light is at the 7 o'clock position. You want to make sure when you are assessing the ears that you assess both ears. Next, we'll be checking for hearing. So Mr. Iso, could you please close one ear? I'll be whispering something into this ear, and you're going to recite it back to me.
1, 2, 3.
Great, so now you can close that ear, and I'll be whispering something into this ear.
A, B, C.
Great, so now this shows that hearing is intact. Next, we'll be moving on to the nose. So upon inspection, we can see that the nose is symmetric and proportionate to the face. Mr. Iso, could you please lift your head back? So we can see that the nares is symmetric. The mucous membranes are pink and moist. So now we'll be checking for patency. So Mr. Iso, could you please plug one nostril? I'll be putting a cotton ball next to the other nostril, and you're going to tell me what you smell.
Alcohol.
Great, so now we're going to do it on the other side.
Alcohol.
Great, so now this shows that the nares is patent for smell. Next, we're going to go into the mouth. So Mr. Iso, could you please say ah? Thank you. So this shows that the lips, mucosa, gingiva, tongue, and pharynx are all pink and moist. The uvula and the tongue are both midline. There is no indentation. There is no bleeding. There's no lesions, and there's no lacerations. There was a rise and fall of the soft palate, so that is intact. There were no missing teeth, no caries, and there's no loose teeth. So now we'll be inspecting the neck. So Mr. Iso, upon inspection, we can see that there are no visual masses or nodules. Upon palpation, the neck is supple, there's no rigidity. Upon palpation of the trachea is midline, easily displaced, and no masses. The thyroid is non-palpable. Next, we'll be checking all of the lymph nodes. So we're going to see the pre-auricular, post-auricular, occipital. We're going to follow this down to the deep cervical chain posteriorly. Then we're going to go to submental, submandibular, and then the jugulogastric. This is where jugulodigastric. This is where we will check for TMJ. So Mr. Iso, can you please open and close your mouth? Can you please do it one more time? So now we can see that he is negative for TMJ and there's no crepitus. So from here, we can go to the superficial cervical chain. Right behind it is the deep cervical chain. And then we can go to the clavicles and we can do the supraclavicular. So now I will be assessing the musculoskeletal system. Pain was assessed and patient denied any pain. So now we'll be doing the scoliosis check. So Mr. Iso, could you please stand up for me? So what I'm going to be doing is I'm going to be putting my fingers and my hand on the base of his spine, and I'm going to be checking the symmetry of the shoulders, scapula, and the hips. So Mr. Iso, could you please bend forward? So you can see that his scapula, his shoulders, and his hips are symmetric. So can you please come back? Great. So now we can see that the scapula, the shoulders, the scapula, and the hips are all symmetric. The spine is erect and aligned. So now we'll be checking the posture. So for posture, Mr. Iso's posture is erect. His joints, his muscles, and his extremity lengths are also aligned. Now we will be assessing for gait. So Mr. Iso, what I want you to do is I want you to take 4 steps normally, and then when you're coming back, I want you to take 4 steps, heel to toe. You may begin. Great. So his gait was smooth, steady, and rhythmic. Now we will be assessing the range of motions. So Mr. Iso, you may have a seat. So we're going to start with the head range of motion and strength. So first you want to flex, then extend, and then circumduct. So he has full range of motion of his head. Next, we're going to assess the strength of your head. So I'm going to be pushing. Do not let me push. And now I'll be doing on this side. Do not let me push. So he has good strength in his head. Next, we'll be moving on to the shoulders. So Mr. Iso, I would like you to elevate your shoulders. Do not let me push down. And now I want you to depress your shoulders. Do not let me push back up. So he has full range of motions of his shoulders and good strength of his shoulders. Next, we are going to do arms. So, Mr. Iso, I would like you to abduct, then adduct, and then circumduct. So he has full range of motion of his arms. So Mr. Iso, could you please abduct? We're going to test your strength now. So do not let me push down, and do not let me push up. So he has good strength of his arms. You want to make sure when you're assessing the arms that you do it on the other side and compare. So next, we are going to do your wrist. So Mr. Iso, could you please flex, and then extend, and then circumduct. So he has full range of motion of his wrist. Next, we're going to assess for the strength of his wrist. So Mr. Iso, could you please squeeze both of my fingers? So he has good strength in his wrist. Now we will be assessing the hip. So Mr. Iso, could you please get up? I have a steady surface here for you to hold on. So what I want you to do is I want to take your leg and I want you to abduct. Don't let me push down and don't let me push up. Then I want you to adduct and then I want you to circumduct. Great. So he has full range of motion of his hip and he has good strength. So next we're going to assess your leg range of motion, so you can sit back down. So what you want to do, Mr. Iso, is you want to flex, then you're wanting to extend. So don't let me push down, and then don't let me push up. And then you're going to want to circumduct. Good. Now we will be assessing the ankle. So for the ankle, I want you to dorsiflex. Do not let me push down. And then I want you to plantar flex. Do not let me push up. And then I want you to circumduct. Good. So Mr. Iso has full range of motion of his legs and his ankles, and he has good strength in his legs and his ankles. Now we'll be doing the testicular exam. When assessing the testicular area, you want to make sure that you explain the procedure to the patient, provide privacy, and drape the patient. For today, we'll be doing education. Mr. Iso, so for a self-testicular exam, you want to make sure that you do this once a month starting at the age of puberty. You want to do this after you take a shower because this is when your scrotum and your testicle are the most relaxed. So it's normal to have rugae on your scrotum. It's normal for one testicle to be descended lower than the other. It is also normal for a spongy-like mass to be above the testicle posteriorly. This mass is called epididymis. Behind it is the spermatic cord, which leads to the vas deferens. So you want to make sure that these three landmarks are spongy and not hard, firm, or mass-like. When doing this self-testicular exam, you want to make sure you take your two fingers and go in a vertical line procedure. You want to do this throughout the entire scrotum and the testicle. For the breast education, you want to make sure you explain the procedure to the patient, provide privacy, and drape the patient. This exam should be done once a month at the same time, 7 days after your period. You also want to make sure you do this exam starting at the age of puberty. It is normal for the breast to have asymmetry, so for the self-assessment, you want to make sure that you put your hands on your hips and lean forward. Check for any dimpling and or retractions of the breast tissue area. Another way to do this assessment is to lie down and put a pillow underneath your scapula. For the self-assessment, you want to make sure that you go in a vertical stripe pattern along the entire breast tissue area. You also want to, don't forget the tail of Spence area, which is right before the axilla, because this is the most common place for tumors to form. You also want to firmly but gently squeeze the nipple at the areola area to make sure there is no tenderness and no drainage. Reasons why you would want to check the breast: you want to check the breast for size, symmetry, edema, lesions, tenderness, and make sure there's no drainage. The 6 post-procedural steps are: first, you're going to turn the bed to the lowest and lock position. You're going to bring the 2 side railings up and then make sure the call light is within reach. Then you're going to assess any additional patient needs and let them know of your expected return. Then you're going to dispose of all PPE properly. Then you're going to clean all equipment that was in contact with the patient. Then you're going to wash your hands. Then you're going to document date, time, assessment, procedure, and the patient's response to the procedure. Things that I wish that could have gone better during this checkoff is I need to get used to where all the lymph nodes are, and the medical terminology, I need to practice it, but I know that'll take time. Thank you.